easy. Let's see if I can fix this, because one time I did this and it was only my face you could see, and that was not good.
Oh,
So,
I mean, that's also nice, but
well, it was a little shocking. I was like, oh, I probably shouldn't have done that. Anyway, okay. Why don't you go ahead and introduce yourself? Like when you graduated from Stanford, what sport you played, just sort of some general tidbits about you.
sure. Hi, guys. Oh no, my roommates are getting home. Hang on, I might have to go to a different room. Who is that? Sorry.
Doesn't matter. It's all good.
Canyon, I'm doing an interview. Okay.
Oh, I'm sorry.
No, it's okay. I was just telling you. This is my roommate, Canyon.
Hello.
It is with Stanford Ames, Athletes in Medicine, with the S. What is the S?
Athletes in Medicine at Stanford.
Oh, Athletes in Medicine at Stanford.
What did you work
Okay. Anyway, we will get back to the interview. So, hi guys, I'm Fiona. I went to Stanford from 2005 until 2009, and I was on the swim team. I swam only for 2 years, and then I retired, I like to say early, because I just was super tired and wanted to kind of explore more things. I wanted to study abroad. After college, I was a hum bio CA for a year, and then I did a master's in management science and engineering for 2 years. And then I went to med school at Hopkins and residency initially in psychiatry, and then switched to internal medicine. Sorry, more roommates. Switched to internal medicine, and now most recently I have just started as an attending at Vanderbilt.
Wow, holy cow.
It's a lot.
That is so fun that you were a hum bio CA. That is so fun.
I loved it. That was probably my favorite job. Like, I think maybe I liked that job more than my attending job.
Oh. Okay, so I guess starting at the beginning of like, why did you choose hum bio? With like the variety of other health options, or even outside of that, like why hum bio?
Yeah. So I knew that I thought that I wanted to be a doctor when I went to college. I think I kind of hadn't really thought about the variety of career options that were out there initially. I'm from a small town in Mississippi, and I kind of thought that you could be a doctor, a teacher, or a lawyer. I didn't realize like the business was a thing you could also do. So I always thought that I wanted to be a doctor. And so I wanted to pick a major that was sciencey, but not too sciencey. I initially wanted to do hum bio because I wanted to study anthropology, which I still think is super, super interesting. But I ended up doing a couple anthropology classes and then deciding that I was more interested in health policy and economics. And I liked hum bio just because it was so broad. It gives you so much flexibility. It's just such a cool major. You get exposed to the A side, the sciencey side, and the B side, the more social science side. And I just liked the breadth that it allowed you to have, and the possibility it gave you to kind of change your mind and move from one thing to another thing. And just, I think that a broad education is so important, and that's what hum bio really gives you.
Yeah, I know. I've had to change my hum bio path 30 times.
Have you? Yeah. What is your concentration?
Well, so it was initially neurobiology, but then they actually canceled 3/4 of my classes that I was supposed to take without really like letting me know.
Oh.
So I had to sort of rework the whole thing, and now I'm much more broad, like you just said, because I was able to take all the classes I actually wanted to. And so now I'm, biological and environmental determinants of health. So
very broad, extremely broad,
yep,
the broadest.
The broadest. Nope, I made it happen.
Honestly, that's so good for med school though. I think it's so good for kind of life in any kind of life as a human, but particularly life in any health related field.
What about, or just like being, because you're able to pull stuff from different places and you don't have like a narrowed mindset?
Yeah, I think so. I think being able to think broadly, or I think having a I think having a fun life, part of it at least, is based on being able to think creatively. And I think when you have a broad array of knowledge, you're more able to think creatively because you can pull stuff from one field and then from another field, and then you can come up with your own ideas, or you can just understand things a little bit better. I think just having that broad knowledge base is so cool. Allows you to, get more out of all parts of the news, and you can be just interested in a lot of stuff. And I think the more things that you're interested in, the fuller your life will end up being.
Yeah. Talk to me about your sort of med school decision process of like, or like deciding to go to med school,
Yeah.
and like when that happened for you, and then once you made that decision, like the things that you did to lead up to med school. I know this question for you is going to be a lot longer since you did your CA and you did your 2 years master's, but sort of maybe like walk through a bit of that timeline of your decisions.
Definitely. So I initially thought that I wanted to be a doctor when I came to Stanford, and then was a hum bio major. And then when I stopped swimming, I kind of had a bit of an existential crisis, which I think is common for athletes when they stop doing their sports. So just as an aside, I think that is a really hard time for everyone, and just be patient with yourself when you're done with your sport. Um, so I started looking around at kind of other fields that I hadn't explored before, and I kind of started taking some economics classes, some philosophy, psychology, and became really interested in fields outside of just biology. And so one of the reasons I wanted to be a hum bio CA was because I wasn't quite ready to decide to go to med school. And I was actually thinking about getting an economics PhD, and doing things a lot more mathy. So ended up doing the hum bio CA thing, and then still couldn't decide what I really wanted to do. I have a ton of outside interests, and typically have found it somewhat hard to make decisions, and I tend to change my mind a lot. So for those people who are really not sure what they want to do, I will definitely talk to them. So ended up, after my CA year, deciding to do MS&E, in large part because I thought I needed more math to apply to my economics PhD program that I was going to do. And so then before I started my MS&E master's program, I actually went to San Diego and did a yoga teacher training program. And then I did another one in San Francisco as well. And I adored my yoga teacher training program. And I loved kind of the reflectiveness of it. We read a lot of kind of yoga philosophy. And that, I think, really changed my interests. It made me really want to work with people, and it made me really want to pursue a career more focused on service. And it was actually difficult for me to come back to my MS&E master's program. And my first class, I remember, was taught by a very libertarian professor, and we were talking a lot about like maximizing profit and money. And having just come back from yoga teacher training, I was like, whoa, this is not what I want to be doing right now. And so I think that yoga teacher training, and then also I read kind of a lot of philosophy that summer, really made me want to do something service oriented. And then I thought, well, what is service oriented? Being a teacher or being a doctor were the two things that I was thinking about. And then I had already done all my medical school prerequisites, because I did those back when I thought I wanted to be a doctor as a freshman and a sophomore. And so I decided to apply to med school. And I think I actually got that summer wrong. I think that was I did 1 year of my MS&E master's, then did yoga teacher training in San Diego, and then kind of had all of those thoughts at that point. But yeah, I had a lot of different ideas. I thought for a while that I might want to work in tech. I thought about working in venture capital. I almost applied to McKinsey like 5 times in my life, so many times. Never actually completed the application, but man.
My mom actually owned her own yoga studio.
Did she?
Yeah,
Oh,
and you're sort of preaching to the choir of having a hard time making decisions because you want to sort of do everything.
yeah.
Um, but like all of my before I would wanted to go to med school, I was mechanical engineering the whole time.
Were
Uh,
you?
yeah, and so that's what I always wanted to do. And then I'm like, wait a minute, I love this, but then I don't. Like I want there's something else for me. I don't know what that is.
Yeah.
It's like grasping at straws, trying to figure out what that is. But anyway,
Yeah. I think that's great though. I think it's in many ways better to come to medicine, like be drawn towards medicine in college rather than like starting as medicine without really knowing why. Like I kind of wanted to be a doctor because my mom was a doctor, I think. And then I moved away from that, but then coming back to it the second time was a much more powerful draw.
yeah.
So
How did you? Because you sort of went gung ho in like all of these very opposite directions, and like all
yeah.
of those things require insane amounts of prep work that usually like um, are very difficult to do even if you had years to plan in advance, right?
Yeah.
And so how did you like I don't know much about the requirements to get into a economics PhD program, but I can imagine that they're relatively extensive, right? But I do know about like the med school sort of application requirements, like having a good GPA and like having shadowing experience and being in a research lab. And so can you talk to me a little bit about like how you were able to do that, and like where that fit in, or if it didn't, like what
Yeah.
happened? Like how'd that go?
Yeah, for sure. So the economics PhD stuff, that was kind of like a pipe dream. I never really got to that. So I just did MS&E, took a lot of classes, did a lot of math, and then decided that was not for me after all.
No, I mean that's
Um,
a lot.
yeah. The med school stuff, I was actually really lucky because I had done almost all of my prereqs in my first couple of years of undergrad. So I did a lot of the chemistry stuff at the very beginning. My high school chemistry teacher in Mississippi somehow was super amazing. And so it prepared me very well for the chemistry part, which was good. Though then I took organic chemistry when I had mono and was on the swim team, and that was just a disaster. Luckily, Stanford allows you to like drop one course, so I got to drop my I retook that organic chemistry course, so that was good. But yeah, so I done most of my prereqs when I was a freshman and a sophomore, and then I decided to when I stopped swimming, I decided to explore kind of a lot of different things because I really didn't know what I wanted to do. One of the things that I explored was working in a basic science lab. And I did that for a good 3 months before I decided that was not for me. It was very basic. We were looking at, I think, the function of the telomere. Yeah, which was cool, but like really not for me. Um, and I didn't do any shadowing at all. And I desperately wish that I had done shadowing because I didn't know what I was getting into. Um, I don't think that you need to do a lot of shadowing, but I think that whatever field you're looking at, just either go to the hospital for a little bit and don't shadow. I think don't shadow and just an attending. I think that if you can, you should shadow like a medical student while the medical student is on the wards. I don't even know if that's possible, but if so, that would be so good. Shadow a medical student, see what that's like, and then maybe try to shadow a resident and then shadow an attending. Because I think all 3 stages are so different from each other. And if you just shadow an attending, like that's not really a good representation of what medicine is like. So strongly recommend shadowing. The things that I did do that I think made my med school application successful is doing things that were a little bit different. So I think the yoga teacher training was actually really helpful.
I can
And
imagine that that's a good talking point.
It is a very good talking point. And I initially, my first residency was in psychiatry, so it was great for psychiatry. So yoga teacher training was really good. And then I think the fact that I had this MS and E masters also was, I think, very useful. I thought initially when I went into med school that I might want to do something as sort of entrepreneurial. And so talking about MS&E was very helpful in that regards. And then I also did some of the classes at the design school. Creativity and innovation was one of them with Tina Seelig, and that class was just so good. And so I think talking about things like that, kind of things that are a bit more humanities based, can actually be really good for medical school and can differentiate you a little bit. I think really just doing stuff that you're very interested in and passionate about, and then being able to convey that to the med school selection committee is what will help you the most. So in a way, I think it's almost two different questions. It's like, what will help you decide whether medical school is right for you? And then I think things like shadowing will help you decide that. And then like, I guess it's a couple of things. What do I like to do? And then just do those things that you like to do. And then like, how does what I like to do fit into medicine? And how can that help me get into medical school once I decide I want to do it? And then like having those three things, I think, are important to think about.
Yeah. So talk to me a bit about like actually med school itself,
Yeah.
and like either what was different than what your expectation was, and like what was difficult about that, or like what you liked best about med school in general.
Yeah. Um, so, you know, initially when I started med school, it was definitely hard because after, I think for anyone who takes a little bit of time off from college before going straight to medical school, the transition going back to school is just going to be difficult. The first 2 years are primarily classroom based at most places. And it's just weird going from being in control of your own time, primarily in control of your own time, or mostly in control of your own time, and like being a TA or CA, or for many people having a job, and then going back to the classroom. It's just like not that fun. And you have to get used to being a student again. And in med school, you are like really a student. Because you're not only in the classroom, but then when you go to the wards, you really are like, medicine is just such a complicated and difficult field. You really don't know, you don't know the vocabulary, you don't know the language yet. So you're really at the bottom of the totem pole when you start. And it's hard because your residents are really busy and really stressed. And so you have to, as a medical student, learn how to deal with the stressed residents and really like learn that when they're busy and stressed, it's not, and they like might seem mad, it's not because of you, it's just that they are so busy and stressed. But you have to get used to that. And that was super hard for me at the beginning, kind of going from feeling like I was competent to feeling like I was no longer competent at all. But I mean, you get past that, definitely get past that. But that's sorry, that was a challenge. The part of med school that I liked the best was definitely meeting the people that I was working with. I had a anatomy lab that we started, I think, the first week in medical school, and I am like really not a good spatial thinker. Like I can do math all day, but not spatial math, and I am so bad at kind of visual thinking. But luckily, my two classmates, one of them was a Green Beret and had basically been a doctor in the field for many years and had taken anatomy classes multiple times. And the other one had been an anatomy TA in college, and he'd TA'd anatomy like 3 times. So luckily, I had great anatomy partners, and it was super fun working with them. And then also 3 of my best friends now were my medical school roommates. And I mean, not only are they fun and we get along really well, but they also, one of them in particular, are just super inspiring. And I feel like I really grew as a person, being exposed to a bunch of my friends in med school.
Yeah. Oh, that's nice. I my actually my really close friend, she was a diver at Stanford, and you actually really remind me of her for some reason.
So funny.
um, anyway,
Right.
um, so then talk to me about your switch from psychiatry to internal medicine, correct?
Yeah, that's correct.
And like how that went and why you chose psychiatry to begin with, and then why you decided to no longer go into psychiatry, and then why internal medicine was next up on the list.
Totally. So why psychiatry? So I loved my psychiatry rotation in medical school. It was super interesting. I think one of the reasons I liked it so much is because psychiatry is one of those fields where the medical student can have a bigger role from the beginning, because so much of psychiatry is talking to patients and talking to the patient's family, and you really, as a medical student, feel like you can make a difference. And that you can contribute to the team. Whereas in like internal medicine or surgery, you likely will feel that way less. Um, so I think I liked that in psychiatry, the fact that I felt like I could contribute as a medical student. Um, and then I also just find psychiatry so intellectually fascinating. I think it is, I decided to go into it because I really like people's stories. Um, and in psychiatry, you get to hear people's stories and you get to almost, like, as humans, we only have one life to live, except if you're a psychiatrist and you can hear other people's stories, it's almost as if you're living like a bunch more lives, and you just get to see the world through a bunch more lenses instead of only your own. And I thought that was very cool, conceptually, and I still do. I think it's amazing. And then I also think that we don't really know how the antidepressants work, or the antipsychotics, or ECT, or TMS, all these things. It's such a new field that I think that that's really interesting. And actually, one of my friends who's at Vanderbilt now, but went to med school with me, is an interventional radiologist, and he is doing, it's totally weird. He's doing like intervention, radiating parts of the brain, and it is helping with OCD symptoms.
Oh,
Yeah, it's totally cool. So I think there's just so much more of that to come. And I thought it would be cool to kind of be in a field that's growing so quickly and is making progress quickly. Um, and I still think that's super interesting conceptually. But I think one of the things that I struggle with in general a lot in my life is thinking about things conceptually versus doing them in practice.
hmm.
And I think when you're going into a job or into a career, you can have all these grand aspirations and you can have this like big conception of what it's going to be like. And at the same time, you might not have actually done the work and you might not like the day-to-day job. And so you really have to be sure that you like both of those things, the concept that will provide meaning to your life, and then also the day-to-day tasks that you're actually going to be doing. And I found in psychiatry, I just don't quite have the patience to be a psychiatrist. I get a little bit frustrated when people don't logically reason. And in psychiatry, like, you don't really have logical reasoning in a lot of these illnesses, and that's why you're sick. Um, so yeah, so I found myself getting frustrated in psychiatry. And then also in my residency, you have to do 6 months of internal medicine as a psychiatry intern before you start your second 6 months as a psychiatrist. And I loved my first 6 months in internal medicine when I was still a psychiatry resident. And I think what I loved about it so much is there are a lot of labs, there are a lot of numbers, there are a lot of parts to the story, and there's just so much to figure out. And a lot of the stuff you have to kind of piece together. It's kind of like solving a mystery. And psychiatry is also a mystery, but psychiatry is a mystery that has a lot of gray. Medicine also has a lot of gray, but it has a little bit more black and white. And I thought that solving the mysteries of internal medicine was just super fun. And I think that as you get more and more knowledge, internal medicine just becomes more and more fun. Because you're able to be more creative with that like broad base of knowledge that you have. You can pull something from here, 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 and then come up with like a crazy diagnosis or a crazy differential diagnosis for someone's like, I don't know, weakness and kidney injury. You can come up with like so much stuff. Yeah. So I switched to internal medicine. I do not recommend switching residencies. It is not easy. So don't do that. I added an extra year to my training. So I ended up doing a year and a half of psychiatry and then 2.5 years of internal medicine. So 4 years total, which was fine, but it was hard. It was hard to do an extra year of residency after my friends had already finished.
Yeah. Yeah, that would be fun.
Yeah. Don't recommend. But, you know, if you change your mind a lot, like me, maybe like you.
Well, it seems like it worked out.
Yeah, I think it worked out. I mean, it's hard. Like I just started my new job now as an attending, and it is super hard. So I'm still definitely getting used to it. And I don't know that I can practice clinical medicine 100% of the time. I actually am pretty sure that I can't. I think I need to have some other sort of role, either an administrative role or right now I'm very interested in maybe doing some addiction medicine, which kind of blends psychiatry and medicine together. And so I think trying to maybe spearhead from the internal medicine side an addiction medicine program at Vanderbilt would be very cool. They have addiction psychiatry now, but they don't have as much addiction medicine. So I might do that. We'll
That'd
see.
be super cool. Huh.
Yeah, it would be fun.
So sort of what you just brought up, like what is the most difficult thing about being a physician that you have found?
Oh my goodness. Um, so the most difficult, so there are so many difficult things. Um, it really depends on your, I think, kind of where you practice. So where I'm practicing right now is in the hospital as an inpatient hospitalist, which is basically like the primary care doctor of the inpatient hospital. So like a patient will come in with an undifferentiated medical complaint, they'll get admitted to medicine, and then the hospitalist will take care of them, and then the hospitalist will like consult GI and consult cardiology or like nephrology, whatever you need to consult. And in my role, the most challenging part for me right now is working with the social workers and the case managers to figure out kind of how to get the patient the safest discharge plan. And that does not sound sexy, and it is not sexy, which is why it's so hard, I think, because just emotionally, it's really, really challenging. And you really realize the issues that our healthcare system in America has created. Like patients don't have insurance here in Tennessee. A lot of them don't have insurance. And so it's really hard to set them up with a primary care doctor, or it's really, really hard to set them up with a specialist who is going to be able to help them with their new interstitial lung disease. And it's like, for example, yeah, this is definitely the hardest thing, I think, is the frustration that I feel when patients can't get care they need. So I had a patient who came in recently who was using injection drugs, and he had AC joint septic arthritis. And so he got a washout of that joint by orthopedics, and they took away a small piece of his bone. And then they put a wound vac on it, which is basically a piece of foam that's attached to a vacuum container. And it helps keep the wound like really clean, basically. But it has to be changed 3 times a week. And so the orthopedic surgery team did this. We like had him on the appropriate antibiotics. He was all ready to be discharged. And then he didn't have insurance. And so that meant that a nurse could not come to his house to help him change his wound vac 3 times a week. And because he didn't have insurance, he can't come to the Vanderbilt clinic to get his wound vac changed. And so we'd set him up with this wound vac and no way to follow up. And so we're like setting this poor guy up to fail. And so then I had to talk to a bunch of people, and what we figured out was that the patient would just have to come walk in to the outpatient thoracic or orthopedics clinic 3 times a week, 2 or 3 times a week. And then they would squeeze him in to change his wound vac, which is just like a terrible, terrible solution. So he doesn't have an appointment. He's coming in, he has to wait. And then I actually called and checked on him to see how he was doing afterwards. And his response was that at his first appointment, he had to wait for an hour, and they said they couldn't change his wound vac. And so then he left, and then he came back the next day. The next day, they were able to change his wound vac successfully. But then the third time he was supposed to come back, like he had to wait for too long. And so he left and didn't get changed. And so it's just like, all of that stuff sounds super boring, and it really is, which is why it's so frustrating. But yeah, that's definitely the hardest part. Seeing gaps in care and not being able to do anything about it in the moment. Like you can definitely do stuff about it, I think, in a policy realm, but that is different from your doctor hat.
Yeah. So then how do you see, like, what is then the best part about doing what you do? Because usually when people say what they love about being a doctor is that they're actually able to make tangible differences in people's lives. And like, I guess it happens very often that you can't, right? So
yeah, I mean, it's not super often. So my role right now, like, is as an inpatient hospitalist. And so I see a lot of people with chronic medical conditions who come in and into the hospital and kind of cycle through in part because they don't have primary care, or they don't have good follow-up with the medical system otherwise. But there are also a lot of patients who do really well. And I think I have kind of 2 favorite parts. One is coming up with a differential diagnosis and then figuring out what tests I need to send to determine what's wrong with the patient, and then like diagnosing them with something is always really fun, especially when it's a rare disease or a rare presentation of a common disease or something like that. And then I also find learning how to think in a very organized way and then come up with schema for different complaints, like a schema for shortness of breath or a schema for elevated liver function tests, and then apply those schemas in real life and then become more comfortable being able to do that on the fly. That's really fun. It's just like really fun to learn how to think in a structured way, especially when you have complicated patients. And there are a couple of podcasts that do this that are so good. And I'm just going to plug the Clinical Problem Solvers. I think they're amazing. They're some folks at UCSF and Johns Hopkins, and they're super good. And so if you're interested in medicine, definitely listen to them. It's a little bit like, it's better for a 4th year medical student maybe, or a 3rd year medical student, but it's still maybe as interesting for undergrads.
What is it called?
It's called the Clinical Problem Solvers.
Clinical Problem Solvers, because I am all about podcasts.
Yes. So it's pretty medicine-y. So you might not know like the words and the language.
I'll pretend like I do.
Yeah, pretend like you do. Just see how it is. Yeah, so that is one thing that I really like. And then the other thing that I recently have loved is just at the end of the day, so at like 5 or 6, when people have stopped paging me, to put in like a Tylenol order, I can just go kind of sit with a patient at her bedside and just kind of talk about what's going on and talk about what she understands about her illness and what I understand about it. And it's really nice because it's just like, there's no time pressure that late in the day, and you can really just, it's kind of a lot of teaching, but it's teaching in a, I think, very empathetic way, and kind of getting to know the patients a little bit more at bedside. I just find really, really nice. and you can make connections with patients. And like if you make someone smile in the hospital when they're super ill, like that's very rewarding. Or like today, for example, I had to tell this poor woman she had metastatic colon cancer. And then seeing her, she was amazing. Actually, she was like, thank you for telling me. Now I know this and I'm going to be able to prepare for it. And the uncertainty is the worst. But now that I know, I can prepare for it and I'm okay. And kind of getting to see her reaction to that and then have a conversation with her about that was just like super rewarding, and also just super amazing to see how some people can cope so well with their illnesses and with terrible news. Yeah. So to summarize, 2 things. 1, diagnosis is really cool and fun. And 2, getting to talk to patients and kind of teach them is also really fun.
Okay, last question, I swear, because I have really enjoyed talking with you, so I've kept much longer than I had advertised initially.
Great. Well, I'm kind of verbose, so
just sort of going back to Ames and like what you think that your unique story or like your perspectives can specifically help somebody with, like what you think you offer to the table. Because like with these spotlights, we like highlight you for a week and encourage people to like reach out and meet with you. So like what you think that you can offer.
Totally. So I would love to talk with people who are kind of unsure about whether they want to go into medicine or not. I have thought about not being a doctor so many times, and I always come back to it. And I will definitely tell you the scoop. I'll give you the lowdown. I'll tell you what it's like to be a medical student, what it's like to be a resident, what it's like to be a new attending, because it is definitely not always easy. Like it is very hard. So you have to be prepared. And I really think you should know what you're getting into. So I think you should try to do some shadowing, or at least try to talk to people who are going to be really honest about what it's like being a doctor. Yeah, so I think that's probably my the thing that I can help with the most. And then people who are interested in internal medicine, I like would love to talk with them about what it's like being an internal medicine doctor and the fun of like diagnosing things. And then things that I'm also happy to do, I'm like happy to read essays or like help with application stuff. I would definitely be willing to do that. I kind of like editing things, so send them along. And then another thing, I don't know whether you guys would be interested in this, but I think it would be really cool to create kind of like a demonstration of what it's like in my job for me every day. So like putting together a little patient story of like the patient comes in with a kidney injury and new anemia, like what do you do? And then putting together kind of just showing people what the steps of the workup are, and then like who you have to consult, and then what procedures actually happen in the hospital, and then what it's like for the patient going home. And just including not only the medical part, but also maybe a little of the social part, and thinking about like whether patients have to go to a skilled nursing facility or a rehab, and like how they get their medicines, and kind of the stuff in medicine that is very real, but is less obvious when you're in medical school, and even definitely in undergrad. I think it would be cool to like create a little thing, follow a patient through the hospital. So I would be happy to do that.
So when you are imagining this, are you sort of imagining like a little video that's put together, or are you imagining like a Zoom thing where you walk through the steps of this patient, or like what's the actual method of?
Yeah, I think it would be cool. If I could do video, I would totally do a video, but I'm not that tech savvy. But like a little PowerPoint, something but like an interactive PowerPoint where you say, you have like a little picture of the patient who comes into the hospital and she's like a little old lady and then she has some complaint. And then it kind of just, you go through people suggest what the next steps might be. And then you go through like what the next steps actually are. And then kind of have like a little brainstorming session, maybe at each step. Like now the patient is medically ready and we have done her colonoscopy and she has nothing has been found on her colonoscopy and she's 84 and she has dementia. What are the next steps? That's difficult. So that idea needs to be flushed out a little bit, but I'll think of something and then I
think that would be really fun. Yeah, no, I think I see your vision. And
I don't really see my vision yet, so.
But something's going on in my mind and I like it. Right?
Okay, yeah.
So, no, totally. Think on that. I will think on it, and I will bring it back to the team and see how more they can develop it and storm along those lines.
Yes.
And I will email you just about like scheduling for quote your week. Most we've had is like 4 people reach out. So I mean, it's not like your week needs to be. It's not like you need to be like in Tahiti just on the beach doing nothing, right? But I mean, maybe not schedule it during like the week that you have some. I don't know, but just being mindful of that.
For sure.
But yeah, no, that's everything. I really could not be more grateful that you were able to meet me. And it was so good meeting you. I really, really loved hearing everything you had to say.
So good to meet you too. I'm excited for you to apply to med school. Are you applying this year?
No. So I actually just got done this summer. My job was canceled. And so, I'm really bummed. And so I ended up taking all of Gen Chem and half of OChem this summer in 9 weeks.
That's so fast.
Yeah, no, I was 15 hours a day of not doing anything but studying, like literally no time to eat. Like I would wake up at 5 every morning to like finish anyway. So I know. So
you're an athlete.
What I do writes in my bones. I don't know. And so then I'm planning on doing a co-term, hopefully in epidemiology. And then, right? Like, wouldn't that be awesome?
Yes.
And then I think the way that it lines up, I would probably just do a gap year and work somewhere or do something. And then that would be my interview year and then go to med school the following year.
I think that sounds perfect. Definitely take some time to do other life stuff before you go to med school.
Yeah.
Definitely worth it.
Well, anyway, thank you so much. We will stay in touch. I'm going to want to meet with you all the time.
Well, you are welcome to reach out whenever.
Okay, awesome. Thank you so much. Have an awesome rest of your night. I really appreciate it.
Thank you. You too. Good luck with your crazy schedule. And
thank you.
Waking up at 4:30 all the time.
It's going to be fun.
Yes, it is.
Okay. Bye-bye. Have a good night.
Bye, you too.